If you're living with a mental health problem, it can be hard to know which way to turn or what to do to feel better. You might go to your GP, and one of the first things they might offer is CBT, which stands for Cognitive Behavioral Therapy.
Hello everyone, today I'm going to explain what cognitive behavioral therapy is, what it is for, what happens during therapy, and how to find a therapist. What is CBT? CBT is a type of talking treatment that focuses on how your thoughts, beliefs, and attitudes affect your feelings and behavior and teaches you coping skills for dealing with different problems. It combines cognitive therapy, examining the things you think, and behavior therapy, examining the things you do. For example, I have depression. CBT is very good for helping me not to listen to my self critical voice, which is so damaging. What's the theory behind CBT? CBT is based on the idea that the way we think about situations can affect the way we feel and behave. For example, if you interpret a situation negatively, then you might experience negative emotions as a result. And those bad feelings might then lead you to behave in a certain way. So, how does negative thinking start? Negative thinking patterns can start from childhood onwards. For example, if you don't receive much attention from your parents or teachers at school, you might have thought, I'm useless, I'm not good enough. Over time, you might come to believe these assumptions until, as an adult, these negative thoughts become automatic or become like a habit. So, this way of thinking might then affect how you feel at work, university, or in your general life. How does CBT work? In CBT, you work with a therapist to identify and challenge any negative thinking patterns and behavior which may be causing you difficulties. In turn, this can change the way you feel about situations and enable you to change your behavior in the future. So, you and your therapist might focus on what is going on in your life right now, but you might also look at your past and think about how your past experiences impact the way you see the world. Now I'm going to talk about the types of problems can CBT help with. CBT is relatively flexible therapy that can be adapted to meet your particular needs. Evidence suggests it can be an effective treatment for a range of mental health problems such as anxiety, bipolar disorder, depression, eating problems, phobias, obsessive compulsive disorder, schizophrenia, and etc. You may also be offered CBT if you are experiencing a mental health problem alongside a physical health problem. The tools and techniques you learn during CBT can often be applied to other problems in the future. You may also be offered CBT for anger problems, drug problems, insomnia, general health, chronic pain, chronic fatigue syndrome. Does CBT work without medication? For some people, CBT can work just as well as medication for treating problems like depression and anxiety disorders. Depending on the symptoms you experience, your doctor might suggest that a combination of CBT and medication such as antidepressant might be more effective for you. If you want to discuss whether CBT is right treatment for you, you can talk to your GP. What should I expect from a CBT session? First of all, how is CBT delivered? CBT is usually a short term treatment, and sessions can be delivered one to one, in a group, self help book, through a computer online like Beating the Blues for Depression program. How are sessions structured? First of all, or at the beginning of the therapy, you and your therapist may explore the problems you want to work on. Then you start to plan the content of the sessions. Then, during the session, you might work through exercises with your therapist to explore your thoughts, feelings, and behaviors. With CBT, you are often given work to do in your own time. So, at the end of each session, you might agree on some exercises to work on afterwards. At the beginning of your next session, your therapist might start by going over the conclusion from your previous session and discussing what progress you have made with any work you agreed to do. What might I learn? CBT teaches coping skills for dealing with different problems. You may learn ways of coping with different situations, thoughts, feelings, and behaviors. What's the therapeutic relationship like? One-to-one CBT can bring you into a kind of relationship you may not have had before. CBT favors an equal, non-judgmental relationship between you and your therapist. They should seek your views and reactions to your experiences, which then shape the way your therapy progresses. The collaborative style means that you are actively involved in the therapy. This therapeutic relationship may help you feel able to open up and talk about things that are difficult or personal to you. Can I do CBT by myself? Yes, you can do CBT by yourself, but research suggests that CBT is usually more effective if you are working with a therapist. Is CBT right for me? Although many people can benefit from CBT, not everyone finds it helpful. You might find that it just doesn't suit you or doesn't meet your needs. So before deciding to have CBT, it might be helpful to think about the following. Is short-term therapy right for me? Am I comfortable thinking about my feelings? How much time do I want to spend? Do I have a clear problem to solve? Comparison with other types of short-term psychological therapy aren't clear-cut. Other talking treatments, for example, the psychodynamic therapy or interpersonal therapy might also be effective, but there is not been as much research into other types of therapy, so it can be hard to say what might work best. What if I don't find CBT helpful? Not everyone finds that the course of CBT they have been offered helps as much as they had like. In this case, you might want to think about the options below. Talk to your CBT therapist about your feelings, find different therapists, ask your GP for a longer course or a different treatment. How can I find a CBT therapist? Your community mental health team, like some nurses, doctors, occupational therapists, and clinical psychologists working in CMHTs, may also provide CBT. These are the resources. Thank you all for listening.